Live from Town Square Towers at the heart of the Jersey Shore. Wake up with Jeremy Grunin. Get up, get out, do something. Join the conversation. 732-505-1160. News Talk Radio WOBM AM 1160 and 1310. Listen online at WOBMAM.com.
Hey, welcome back. Wake up with Jeremy Grunin. It is 7:09, Wednesday, August 31st, 71 degrees, getting up to 86 today. WOBM AM 1160 and 1310. News Talk Radio, streaming live on the Radio Pop app and WOBMAM.com. 732-505-1160. Join the conversation. We are now joined in studio by Dr. David Greenberg, medical oncologist with Meridian Cancer Care, of course, part of the Hackensack Meridian healthcare system, newly formed. Good morning. How are you, Doctor?
Good morning. Thanks for having me.
Absolutely. Thanks for coming in bright and early for us. So we are talking really great cancer care close to home. Why don't you tell everyone about your background and how you got into this particular area of expertise?
It's the question I get asked a lot, especially, dealing with oncology, and it can be a pretty somber topic at times. But, through my training, through medical school, when I was going to medical school in Brooklyn, and through my residency, which was up at Robert Wood in New Brunswick locally, my experiences with particularly the oncology patients was very rewarding. Found it to be, you develop very intense relationships with the patients. You get to really get very involved with the patients and their families. And besides that, the technology with oncology and the treatments that have been changing and growing throughout the years is very rewarding. I think it's one of the fields that's been growing by leaps and bounds. And, besides helping patients and family members, it's also very exciting from a scientific aspect. Because the way we treated cancer, even when I was training, is actually almost completely different than the way I'm treating it now. And I don't think there are many fields that you can really say that change, that radically over the years. So, the combination of the sciences and relationship and really spending, a lot of time with patients, it really drew me to the field. And it was just a good fit for me throughout my training.
Right. Well, that's great. So what are some of the most common types of cancer that you and your colleagues deal with? I mean, I think we could probably guess some of them, but I don't know. That's changing too, right?
Yeah, that's changing too. But still, the most common cancers we see are the ones, like you said, most people hear about. Breast cancers, obviously, everywhere. It seems like colon cancer, prostate cancer, lung cancer. A lot of the standard cancers that, probably unfortunately a lot of us have family members or loved ones or friends who are afflicted with. And then of course there's a lot of more of the rare tumors that we see. Pancreatic cancer, which is not so rare anymore, seems to be making a lot more headlines because it's just such a lethal type of cancer and seems to be happening more and more. Leukemias, lymphomas, you have a lot of blood disorders. We see a lot of those. I'm a general oncologist. I don't subspecialize in any particular type. So again, I get to see the whole run of different tumor types, which again is rewarding rather than just focusing on one specific type. But again, the bread and butter would probably be breast, colon, and lung if I had to put into three.
Does it still amaze you when you diagnose breast cancer and it's someone that has not kept up with getting their, coming in for regular checkups, right? Does it still amaze you that exists and that with so much talk about make sure you get, mammograms regularly, make sure you're coming in regularly, that people still don't heed that warning and they end up, in a position that they shouldn't necessarily be in?
It does, although it surprises me less and less because it's actually still pretty common. I'd like to say it's probably less common than it used to be. But, denial is a very strong emotion. And, unfortunately, if I speak for most oncologists, that we all have these experiences where patients do come in and they just neglect their screening and they have a very large, breast cancer and it's been there sometimes for years. And you kind of scratch your head and say, well, wish you could have come in sooner. We might have had more options, but, we'll do the best we can. But again, I think that's happening less and less because of the fact that education is out there and public awareness and patients and people are getting their screening tests done.
Good. So talk a little bit about some of the risk factors for cancer. For example, lifestyle factors. What would those be?
So there's no one specific issue regarding getting cancer. There's no specific toxin that you have to avoid. I think it's kind of a generality. And of course, you can go online and read about all sorts of things that could or could not cause cancer, and most of those are unfounded. But I think in general, besides obviously genetic issues, which of course there's a lot of genetic problems regarding, developing cancer. But outside of that, environmental issues, we've heard of asbestos. Everyone knows, again, it's not really around much anymore, but we still see it from time to time. So there can be a lot of toxins in the environment. There's a lot of exposures we have day to day. But I think, staying away from the obvious issues like or things that you shouldn't be doing, like smoking. I think we all know that smoking is a very common cause of cancer. And hopefully a lot of people aren't doing that anymore. Alcohol use in excess can be a problem. Exposure to the sun and ionizing radiation and UV rays obviously is another problem and can trigger cancers. So it's a combination of lifestyle and I think environment. And people always come in and say, well, what can I do to avoid? Or you can be the healthiest person and run triathlons and eat vegan and whatnot, and unfortunately still get cancer. I mean, it's not a guarantee, but I think if you want to minimize your risk.
Sure.
Obviously, being fit and doing some sort of exercise, a couple times a week, and avoiding fatty foods and saturated foods, and running to the food chain stores that people like to go to, and whole grains and vegetables and wheat, those kinds of everything that you learned when you were a child about what's healthy lifestyle and eating still holds true today.
Another one that still amazes me, by the way, is when you see people like chain smoking. And it's like, how, do you not get what? Do you just not get it? It just doesn't matter. What do you think about? And we're going a little bit off, but I have to ask. What do you think about the whole vaping thing?
Right, I know. So we don't know is the bottom line, and actually every couple of months there's another update from the various administrative organizations about that we just don't have enough information, and it's certainly not recommended. Because it's still chemicals, and even though it may not be the same chemicals found in cigarettes, you're still inhaling something in your lung that you shouldn't be.
Right.
And I always say, the only thing you should be inhaling is the air, and even that is debatable in certain parts of probably the state or the country. But anything outside of oxygen is probably not something that should be going into your lungs.
Absolutely. Yeah. That's a safe rule to live by, right?
Yes.
All right. When we come back, and we are talking with Dr. David Greenberg, medical oncologist, Meridian Cancer Care. I want to talk. We hear this. I feel like I hear this every week now when we talk to a doctor, or is the multidisciplinary approach. So I want to understand what that means relative to Meridian Cancer Care and relative to how you guys kind of work together and girls work together to get the right treatment options, the right diagnoses, et cetera, et cetera. Is that okay if we talk about that when we get back?
Absolutely.
That's great. Wake Up with Jeremy Grunin, back right after this.
Stay tuned for Preferred Company with Joel Markell and Marianne Levy at 8. Wake Up with Jeremy Grunin continues next. News Talk Radio WOBM AM 1160 and 1310. Get up. Get out. Do something. Wake Up with Jeremy Grunin continues. News Talk Radio. WOBM AM 1160, 1310, and WOBMAM.com.
Hey, welcome back. Wake Up with Jeremy Grunin. We are here with Dr. David Greenberg, medical oncologist, Meridian Cancer Care. And so, we were talking when we went away a little bit about the multidisciplinary approach to care. So why don't you kind of give us the skinny on that?
Sure, I know it's a mouthful to say, but it is a term that's being used more frequently, especially in the Meridian system. And basically what it is, it's a team approach of doctors. So, and I kind of think of it as one-stop shopping to some degree. So instead of when someone is diagnosed with cancer, obviously it's a scary time, and you want information, and you want to get to see the specialists and the doctors in a timely fashion. And this is kind of one way to bring everything together in one place. So it usually is a board or a group of multiple physicians, including medical oncologists like myself, radiation oncologists who will give radiation, surgical oncologists. A lot of times that comes into play with lung cancer and colon cancer and other types of disease, and breast cancer, obviously. and other support people, such as nurses, nurse navigators, which is actually an incredible system they have at Meridian, which are nurses that just are there for the patient and helps the patient navigate through the system, as the word navigate is there, to get their scans, to get their tests, to get their blood work, their appointments, etc. And what it does is it allows the patients to see all of these doctors and these disciplines in a timely fashion and get the information they need and get on a treatment plan as soon as possible, because that's always everyone's concern is, okay, you've been diagnosed with this terrible disease, now let's move forward and let's do something about it. And with the doctors and the nurses and the social workers and nutritionists and physical therapists, you name it, it's a team approach, and it allows the patients to get a thorough care and able to bring everyone together to allow the treatment to start as soon as possible.
Right. So when we talk treatment, how important is it to have those cancer resources closer to home, right, as opposed to having to travel?
Right. So, a lot of times when people get diagnosed with cancer, they talk to friends or family, and they're told, oh, you got to go here, you got to go to the city, you have to go to whatever big institution you want to fill in the blank. And I think what's happening here locally, which is great with Meridian, Hackensack, and all the resources that they're putting into the cancer care system, that's not necessary anymore. I mean, we can get great outstanding medical cancer care right here locally in your own backyard. So to have to travel to places that may be 1 to 2 hours away is not necessary anymore. You can get the same outstanding care right in your own backyard, so to say. And a lot of the doctors have been trained throughout a lot of these, universities and facilities, including myself. So, you're getting the care here, and we're bringing it to home.
Right. What is, so there's a new, I saw there's a new Meridian Health Village in Jackson. What is that? I mean, because it's not a hospital per se, but what is that?
It's not a hospital, but it basically, again, is everything under one roof. And there you can go, and they have, internal medicine doctors and a bunch of subspecialists, but also there's a large area for, designated just for cancer care. So we do have, medical oncologists there, radiation oncologists. You can actually get your radiation in that facility. There's a CAT scan machine. There's surgical oncologists that have office space there. So again, that's a space that's been dedicated to the doctors to see these patients. And sometimes we see them the same day, whereas patient will come see me as a new visit, then an hour later we'll walk down the hall and see the radiation doctor, and then an hour later walk down the hall and see the surgical oncologist. So they walk out of that building seeing everyone they need, having all their appointments, and having a treatment plan sometimes within one day, which is, you can't really do any better than that when it comes to, expediting things.
Right. And it's all part of the kind of the overall strategy now of, caring for a community as opposed to just caring for the sick when they enter your facility. It's more, when you enter a hospital, it's more about having all these satellite locations so that you can give comprehensive care to the full community. Whether it be at a MedEmerge, whether it be at a something like the Health Village or at the hospital, all those opportunities are there to make sure that we're taking care of our communities better, right?
Exactly.
Some of the treatment options that are considered when determining a plan of care. So what kind of treatment options are there?
So, I keep mentioning radiation oncologists and surgical oncologists. So, there's some cancers, again, depending on staging, a lot of this is based on staging, but there's some cancers that we use all three disciplines, meaning that you'll have your surgery, let's say if you're breast cancer, then you'll follow up with a medical oncologist and a radiation oncologist to receive radiation therapy and then potentially chemotherapy or anti-hormone therapy. And again, that's just an example for breast cancer. So, a lot of times patients do get all three modalities. Sometimes they only need surgery. Sometimes, unfortunately, in later stages of cancers, the surgery and radiation are no longer options. And then we're specifically just talking about, frequently chemotherapy, which is, infusing, chemicals into the body. Although, again, that's changing because chemotherapy has really dramatically changed over the last decade, and now there are oral forms of chemotherapy where patients can take a pill at home in the convenience of their home, not needing an infusion or sitting in a doctor's chair. And a lot of times these therapies are more targeted. Besides being oral, they're more targeted and sometimes more effective.
Cool. With
less side effects. So that's the future of cancer care.
That's great. And I know the other great thing about Meridian is that they're a system partner of the Rutgers Cancer Institute of New Jersey, which gives you a lot more opportunities to to see kind of clinical trials and be really on the cutting edge of what the new treatments are. When we come back, though, I want to talk prevention and education. I want to kind of go through some of the screenings that can help identify and what ages the folks should be going through them and start addressing them. And then, of course, we give you your magic wand. And maybe your magic wand, you can help the Mets make it to the playoffs again this year. What do you think?
It's funny. That was going to be what I was going to suggest. I don't think there's any magic that can help them, unfortunately.
Wake up with Jeremy Grunin and Dr. David Greenberg, medical oncologist, Meridian Cancer Care. Back after this.
The news is next. Live from the WOBM Newsroom, the Town Square, New Jersey News Network, and Fox News Radio. Wake up with Jeremy Grunin. News Talk Radio WOBM AM 1160 and 1310. Live from the Jersey Shore to the world. Get up, get out, do something. Wake up with Jeremy Grunin. Take the show wherever you go. Download the free Radio Pup app for your smartphone or tablet. Join the conversation, 732-505-1160. News Talk Radio WOBM AM 1160 and 1310. Listen online at WOBMAM.com.
Hey, welcome back. Wake up with Jeremy Grunin at 7:36 a.m. Wednesday, August 31st, 71 degrees, getting up to 86 today. WOBM AM 1160 and 1310 News Talk Radio. Streaming live on the Radio Pup app and WOBMAM.com, 732-505-1160 to join the conversation. We are joined in studio by Dr. David Greenberg, medical oncologist in Meridian Cancer Care, part of the Hackensack Meridian Healthcare System. So, look, we it sounds like a broken record. We've talked about it multiple times already this morning. Prevention, education. Why is it so important to catch cancer at an early stage?
Well, when cancer is caught at an earlier stage, clearly the statistics are better. Patients tend to do better, and survival is much better. And there are more treatment options usually available the earlier a cancer is caught. As I mentioned before, when cancers are caught, unfortunately, in the later stages, a lot of times treatment options such as surgery, radiation, and a variety of other things may be off the table. So the sooner we can catch a lot of these cancers and the earlier the stage we can find them, generally the better the patient does and the more options we have. So again, prevention is key to patients doing well and surviving and living a normal life expectancy, ideally. Right. And there's a variety of different screening tests.
So why don't you go through those a little bit, and let's hit on those and what age or point in time people should be having those screenings.
Right. So, obviously breast cancer, one of the hottest topics out there right now. Mammography, I think everyone knows what a mammogram is, and it does save lives. And I am seeing patients more and more now with very early stage breast cancer because of that. There's no doubt. I see it in my own practice. And women should probably start getting mammograms roughly around 40 years of age. That's what the guidelines recommend. Although, again, depending on your family history and other factors, genetics, etc., some women decide to maybe start a little bit earlier, like their late 30s. But by 40, you should at least have your first mammogram, right. and then should be going yearly for most of your life. And again, that's the best way to catch these tumors when they're sometimes even what we call precancerous, where they can be excised and taken care of and never heard from again. The other screening test that's very important is colonoscopy. In detecting colon cancers, in their earlier stages. The recommendation is typically to start at 50 years of age. People are fearful of the colonoscopy. They hear all sorts of stories, but it's really not that bad at all. I mean, the prep apparently is the most unpleasant part, but the test itself, you go to the office, you get a little sedation, you wake up, and the test is over, and hopefully it'll be normal and clean, and then you can feel good for the next 10 years. But again, that's really the only way to catch these colon cancers in their earlier stages. Some people do get screened earlier than 50 years of age. Again, if you have a family history, if someone's been diagnosed with colon cancer in your family at a young age, you might decide to get screened a little bit earlier. But by 50, you should at least have your first colonoscopy.
Right.
And that's pretty standard in this country. And again, saves lives and detects cancer at a much earlier stage where we can offer the surgery and other options and potentially cure people of their disease.
Okay. What about cervical cancer?
Yes, so cervical cancer is another, preventable, detectable cancer. Again, assuming you're getting the screening. So, the guidelines recommend, starting about the age of 21. And depending on your sexual activity level and your lifestyle, you can probably stop at a certain age, whether it be in the 60s or 70s. But you should be getting a gynecological exam, yearly, and a Pap smear, at least every 2 to 3 years to avoid, and prevent any form of cervical cancer.
And obviously, skin exams, especially this time of year. If you see something unusual, probably have it checked out. If something grows on you that you haven't seen before, probably a good rule of thumb, right?
Absolutely, especially I know by the shore area. Obviously everyone should be using their sunscreen, which is very very important. And again, that's one of the more preventable types of cancer if people are really careful and diligent about not getting burned. But yes, especially if you have fair skin or have a history of sunburns, you should be seeing a dermatologist at least on a yearly basis to get a full body screen check. But you yourself should be checking yourself in the mirror.
Well, I use SPF 400, so I make sure that I don't, because I go right to crispy. All right, so it's time. Dr. David Greenberg, it's time where we give you your magic wand, your pixie dust, your fairy dust, your ability just to, wiggle your nose and make an impact on the world, make something change. We've already discussed that you can't help the Mets, but they're only 2.5 games out. So what would you do if you could make that impact?
So yeah, that's a great question. There's so many things that I potentially think of, but I think to develop some form of screening test or some sort of maybe easy, simple blood test that everyone has access to that can help detect all forms of cancer at a very early stage would probably be ideal, and something that I think would change the world. Something that's easy to do, something like a blood test, and something that's very effective and will pick up. I don't know if you can have some sort of like panel that says, well, you are at risk for these types of cancers. This is what you need to look out for, kind of thing. But something to help really prevent and pick up and find these cancers at the earliest stages would be, I think, changing, life-changing for everybody in this world.
So I know that if people want to find out more about educational programs or screenings, they can find that information online on the events calendar at meridianhealth.com. That's Meridian, MERIDIAN, health.com. Or they can, of course, call 1-844-HMH-WELL, right? That's always a good way to go.
Correct.
Dr. David Greenberg, medical oncologist, Meridian Cancer Care, part of the Hackensack Meridian Healthcare System. Thank you so much for spending some time with us bright and early this morning.
Thank you for having me.
Absolutely. More Wake Up with Jeremy Grunin back after this.